Interview today with Rhonda Evans, who is with Touchstone Ranch Recovery in Texas, and you can find them at equinetherapytexas.com. Rhonda is a certified in equine assisted psychotherapy and became a member of the Equine Assisted Growth and Learning Association, and she is currently in the advanced level of training with EGALA, and I'll let her explain that. So, Rhonda, welcome.
Hi, good morning.
Hey, great to have you. Can you share a little bit about your background and a little bit about Touchstone Ranch Recovery, please?
Sure. I'm a licensed master social worker and an LCDC, which is a licensed chemical dependency counselor. I've been in the field about 13 years of chemical dependency. About 2 years ago, I was asked to come out to Touchstone Ranch and start this program. We'll be in existence 2 years come May. We're a small facility, just 11 beds right off. We're in the process of building to 20, so we're in construction at the moment. But the owners of the facility are both in recovery and wanted to give back. And so they opened up their ranch. We're on a working ranch, and we're based off the 12 steps of AA. And we're inpatient treatment, but we offer equine assisted psychotherapy as well
Uh-huh. And
in
so,
all
can
three
you talk a little
facilities.
bit about equine therapy as it relates to drug addiction treatment and why equine therapy is one of the methods that seem to work pretty well in getting people off of drugs?
Sure. We utilize equine assisted psychotherapy, so that means all of our work with the horses is done on the ground. It's not riding. The equine, the horses allow the patients to get hands on and personal. It's very experiential type learning. We work on the steps. Very therapeutic for the horses mirror the patient, so it's very therapeutic. They get an opportunity to see themselves in the horses and what the horses relate to them. Whatever the patients are feeling, the horses will seem to mimic that and mirror that in the arena. So if they're having boundaries issues or something to that effect, the horses will walk away from them. It's very they learn how to see themselves in the horses, and it helps them to really work on issues such as boundaries and trust and communication. Very therapeutic.
Okay,
The horses do all the work for us. They're the
so
therapists.
the horses have no baggage, in other words, and the horses, um, the horses don't have any issues with anybody, basically. Is that right?
That's correct. That's correct.
So they have,
But if you walk into the arena angry, the horse will walk.
yeah. So the horse isn't prejudiced with the person. Is that right? I mean, so their actions will always be consistent. And so if the person who is addicted or has certain hangups, so to speak, I'm not a clinician by trade. I'm a marketing person, but if the person has some sort of a hangup, the horse will probably react to that hangup. Is that? Can you talk a little bit about that?
Most definitely, yes. Yes, for instance, if we have someone who's got a history of abuse issues or something like that, and they drink and do drugs to cover up those abuse issues, they continue to walk away from those or run away from those issues. If they go into the arena and we ask them to go and halter a horse, that a horse may take them several attempts to catch that horse because that horse will continue to run away from them. And then we can relate that to we'll ask the patient, what is that horse, how do you relate to that horse? And she's like, for instance, I continue to run away from my issues. They can start seeing that in the horse's reactions to them.
Okay, so
And it may take a period of time for them to
okay,
recognize that.
so can you talk a little bit about the trust factor between, because I guess trust and fear are something that we humans all have experience with, and horses probably have react
Right.
to trust and fear as well. Can you talk a little bit about that?
Sure. Fear is a major underlying feeling with usually with all patients. They'll kind of scamper around it, but it usually comes down to the bottom line of being fear. But they learn through touch and through taking responsibility and learning how to just, you know, observe the horse and learn how to halter the horse on their own. That they learn to trust and they build that trusting relationship. And so those animals teach them that a tangible way to learn that feeling. So just going and grooming them or just touching them or just rubbing on them will teach them that they can eventually trust and they're not being talked back to.
That's a good feeling. um,
I had to learn to be quiet.
yeah, I guess we all have to learn to be quiet sometimes. Uh, take me through a typical day of, yeah,
It's
unlearning.
called
Yeah, that's a big one.
unlearn. Right.
Talk a little bit about what a typical day looks like there. With, I take it you guys are a 12 step. I understand that you're 12 step, and talk to me about a little bit about the process
We're based off of 12 steps.
of the day.
Yes. Okay, well, because we are on a working ranch, we have a little corral down beside the facility where we keep like baby donkeys or miniature ponies or something that the patients can get up in the mornings and go down and be responsible for. And they have to feed and water those certain animals. There's usually two or three down there in the morning and at night. But it's teaching them how to take responsibility, and that happens around 7:30 in the morning, right after breakfast. Then they come back to the unit and they get prepared for the day. They do their morning meditation, and that goes from like 8:30 to 9 o'clock. And then at 9 o'clock they do a life skills group, which works on everything from communication, stress management, anger management, that type thing. And then at 10 o'clock they do denial or equine assisted psychotherapy. We do that 3 days a week. Um, and then 11 o'clock is DCD, which is dynamics of chemical dependency, which focuses on addiction and the disease concept. Then they have lunch from 12 to 12:30, and they're on free time till 2. And at 2 o'clock they do a process group, and that's just processing feelings about what's going on with their day, their autobiographies, things of that sort. 3 o'clock is relapse recovery dynamics, and 4 o'clock is big book study. 5 o'clock again, they're taking care of the animal. 6 o'clock is dinner. 7 o'clock is an outside or in-house AA or NA meeting. And then they're on free time from about 8:30 to 10. So it's
Okay,
pretty structured all
and
day long.
you're doing what, 30-day programs, 90-day programs?
30 to 90, depending on the
Got
patient's
it.
medical necessity.
Okay. And
And we have a family
okay,
program
talk
on
to me about the
Saturdays.
family program. How does that work? Let's say if I'm, you guys are in near the Dallas Fort Worth area. If I'm from Corpus Christi, I mean, I guess I come up there for the weekend and then
Correct.
spend time with my loved one that's in treatment.
Yes. Right. On Saturdays from 10 a.m. to 12 p.m., we do family education, and that's strictly for the families, for them to learn about the disease concept of addiction, learn about relapse recovery dynamics, learn about communication. Then they get to have lunch with their family member. And then at 1 o'clock, we do a big family group process with all the patients and family members are together. And then they're on visitation from like 2 to 4. But we also offer individual family sessions. We'll just have the individual families meet with a counselor as well. and then there's visitation on Sundays from 1
Okay.
to 4.
And so, how important is it to have the family involved, in your opinion?
It's vital. It's vital to have the family involved in this program. I mean, their family is this the one disease that affects the whole family, so it's vital to get everybody into the recovery
And what
aspect of treatment.
happens if the addict can't get the family to participate?
Well, as a counselors, we try to do a phone call with the family members one time a week, and if we can't, if they're out of state or something like that, we'll do phone conjoints over the phone with them, and then we of course refer the families to Al-Anon, try to get them involved in any way possible. And if they choose not to, then we try to establish some type of other support system for the patient
Okay.
upon discharge
So,
through AA or
okay.
yeah.
As far as a process is concerned, if I have a loved one that wants to come into treatment there, you guys are a private pay. Do you take insurance? How does the financing work
Private pay and
and insurance?
insurance. It's private pay and insurance. Yes, and insurance. And if we're not in network with that insurance company, then we'll call and try to do single case agreements
Okay,
with any
great.
insurance company.
I
They just have to
Okay,
call us.
awesome.
Yeah.
I don't know if I've got any other questions or any other questions that I should be asking. Do you have any other things that you'd like to share to our audience?
I just think that we offer Touchstone Ranch. Being on a small, being on a working ranch, we just offer a different. Like I said, it's treatment. It's cross the board treatment, like any other treatment facility that offers the equine assisted, psychotherapy. That's a big plus for us. Um, the ranch gives it a piece of walking out here, just kind of just surreal. It's peaceful. It's a lot of serenity, um, and they can just check us
Okay,
out on our
and
website. And anybody's
okay,
welcome to
awesome.
come
I
come
just wanted to
talk.
ask you one more question. What are you guys seeing as far as trends go in addiction? Are you
Yes.
seeing more cases with prescription drugs or illegal drugs or alcohol, or are you seeing all of the above? What's the cross section like?
I think our trend right now has been prescription drugs, alcohol, and
Heroin.
heroin. That's kind of our top three
Okay.
right now. Yes,
And I guess people can get heroin,
it's
really.
coming back
I guess
full
people can
force.
get that anywhere. Yeah,
Pretty much
amazing.
anywhere. Mhm.
So, well,
Yes.
this has been very helpful. And how many people do you have on the staff there?
I have about
12, so it's
12
almost a
right
one to
now
one.
currently, but hopefully in June we'll. Yes, yes. We have three. Like I said, I've got four counselors on staff. We have a medical director and a nurse, and then of course when we upgrade our beds to 20, hopefully in June, then of course we'll almost double our staff. But we're gonna hope to upgrade
Awesome.
our bed size to 20. But the small environment, yeah,
Excellent. Well,
is
it
very
sounds like it.
beneficial.
So, yeah,
Very
awesome.
individualized.
Well,
Yeah.
this is Jim Peak speaking with Rhonda Evans at Touchstone Ranch Recovery. You can find them at equinetherapytexas.com, and we are at treatment-centers.net. Um, Thank you very much, Rhonda. We greatly appreciate your time.
Thank you, Jim. No problem. Thank you so much.